My name is Chloe Chisholm, and the topic I chose to research is hypertension, other known as high blood pressure. 1 out of 2 Americans in the United States suffer from high blood pressure each year. This is why it is so important to talk about and discuss the treatment and prevention of high blood pressure. When out of control, high blood pressure can be fatal, killing around 10 million Americans per year. There are many signs and symptoms that you suffer from hypertension, such as dizziness, recurring headaches, nosebleeds, and shortness of breath. Your blood pressure is considered high when you have a blood pressure reading of 130 over 80. However, some people say hypertension can be symptomless, so it is important to pay attention to your health to get your hypertension under control. If not, it can lead to heart attacks, strokes, and much more. There are many factors that can cause a person to develop hypertension. One of the most common causes is unhealthy lifestyle choices, such as not exercising, being overweight, or eating a poor diet can increase the risk of developing high blood pressure. Other things that can lead to hypertension are diabetes, old age, alcohol, and tobacco use. You may also suffer with hypertension if it runs in your family because it can be hereditary. It is good to think about these things when figuring out the solution to treat your hypertension to treat it the proper way. The diagnosis process of hypertension is simple. The most accurate method is APBM. This measures your blood pressure throughout a 24-hour period while doing daily routine activities. This helps record your blood pressure in the day and the night to assess if you suffer from hypertension. Another method is HBPM. However, it is not as accurate. It is recorded by the patient, and it is not recorded at night, which can be very important when diagnosing your hypertension. There can also be lab tests performed, such as your urinalysis, blood cell count, and an ECG. These additional tests can better inform doctors to help treat your condition. Your primary care provider, a cardiologist, or a nephrologist can best diagnose the symptoms of hypertension. They will recommend better self-care and medications to get your condition under control. For medications, an ACE inhibitor, a beta blocker, or diuretics are highly recommended. And for self-care, exercising regularly, quitting smoking, stress management, and recording your blood pressure at home on a regular basis are the best treatments. All these things are important to treat your hypertension. Another quite common factor in the treatment of hypertension is maintaining a better diet. It is recommended to limit sodium, sugary drinks, sweets, and red meats. You also need to cut back on foods that are high in saturated fat, cholesterol, and trans fat. There are also things you need to eat more of, such as fruits, vegetables, and low-fat dairy foods, as well as whole grains, fish, poultry, and nuts. The DASH diet was designed for people who suffer with hypertension, and these include foods that are rich in potassium, calcium, and magnesium. Follow this healthy eating plan and you can treat and prevent your high blood pressure. High blood pressure can be a very scary thing and can put you at risk for many life-threatening conditions. It can lead to stroke, heart failure, kidney failure, and many other medical conditions. This all depends on how well your hypertension can be controlled. Hypertension causes these conditions by damaging your arteries by making them less elastic, which decreases the flow of blood and oxygen to your heart. Hypertension can easily be life-threatening if it is not diagnosed and treated properly.